Hello and welcome. My name is Khalid Pitts, and I am the Vice President of Policy, Advocacy, and Coalitions at the Rockefeller Foundation. As in indeed my honor and pleasure to welcome you to the Rockefeller Foundation's reception tonight as we honor the past and future collaborations in global health. We are so thrilled to be joined by so many representatives from the World Health Organization and leaders in the health policy and advocacy. And thank you so much for being with us this evening. As many of you know, this reception marks a significant milestone for the Rockefeller Foundation. This past January, the foundation was admitted into the official relations with the WHO. Thank you for clapping. Thank you so much. And so tonight we're celebrating our official non-state actor status and reflecting on the over 70 years of collaboration with the WHO to improve the health and well-being of the world. On your chairs, you'll see cards detailing the history of our relationship, which dates back to 1946, when the Rockefeller Foundation was an observer to the signing of the WHO's Constitution. And throughout the last 70 years, both organizations have worked to eradicate disease, promote research into new vaccines, and most importantly, improve the health equity around the world. The Rockefeller Foundation is committed to deepening our partnerships with the WHO and others across the public health space. And we look forward to new collaborations as we work towards shared goals of reaching global vaccine equity, preventing future pandemics, and tracking emerging health threats. And so this evening, we'll begin with a few video presentations, followed by a panel discussion on how we can collaborate to build a comprehensive pandemic prevention system, moderated by Dame Sally Davies. Following the program, we will have time to mingle like we were before and connect with each other. So please help yourself to drinks and food throughout the event. So to kick things off via video, I would like to now hear from Dr. Tedros, Director General of the WHO, and Dr. Shah, President of the Rockefeller Foundation.
Dear Raj, dear colleagues and friends, for over 100 years, the Rockefeller Foundation has been at the forefront of efforts to use science and technology to improve public health. I congratulate the Rockefeller Foundation for its entry into official relations with WHO as a non-state actor. The Foundation's Pandemic Prevention Institute and the WHO Hub for Pandemic and Epidemic Intelligence in Berlin will be working together in a number of areas, including strengthening genomic surveillance and developing user-centered approaches to improve public health decision-making. WHO welcomes the close collaboration with the Rockefeller Foundation for both this and future projects. At the World Health Assembly, WHO is presenting a proposal for strengthening the global architecture for health emergency preparedness, response, and resilience. This new architecture includes recommendations for strengthening the governance, financing, and systems and tools needed to make the world safer under a new international agreement, which WHO member states are currently negotiating. Civil society support, advocacy, and input for both of these efforts is critical. WHO is proud to have the Rockefeller Foundation as a partner with its depth of experience and willingness to take bold steps as we work collectively towards a healthier, safer, and fairer world. I thank you.
Hello, everyone. We're here today to recognize the long-standing partnership between the Rockefeller Foundation and the World Health Organization. And we want to celebrate the news that our partnership was formalized for the first time just this year. For more than 70 years, our organizations have worked together to make the world healthier, and as a result, more equitable, prosperous, and peaceful. Together, we've improved the health of children and adolescents, fought HIV/AIDS in Africa and around the world, and helped countries maintain essential services during the COVID-19 outbreak. That's just one way our organizations, together with institutions and individuals around the world, have tried to respond to the current COVID-19 pandemic. But today, it is clear these extraordinary actions have not been enough to meet the moment. Right now, we're witnessing a great divergence. Many wealthier nations are well on their way to recovery. Meanwhile, lower income countries currently face a 16% vaccination rate, hundreds of millions of people pushed into poverty, and billions of dollars in debt servicing payments this year alone. This great divergence will likely accelerate in the months ahead due to the rising costs of food and fuel, as well as skyrocketing interest rates. And this divergence will make people less healthy and make the world more vulnerable to future public health threats, to climate change, and much more. But at the Rockefeller Foundation, we believe crisis also presents opportunities. We believe if we work together, we can not only end COVID-19 once and for all, we can also build better public health systems for everyone, everywhere. We're proud to be working with the WHO on several key initiatives that will help us do so. First, humanity has every tool needed to end this pandemic. We just need to put those tools in the hands of the people who need them the most. As part of our global vaccination initiative, the Foundation is investing $55 million to support country-led efforts to vaccinate 90% of the most at-risk populations in Asia, Latin America, the Caribbean, and Africa. Along with WHO's Regional Office for Africa and other important partners, we'll also help respond to health disinformation and boost vaccine demand. Second, we're also gathering the tools the world needs to prevent and, if necessary, respond to the next pandemic. With the WHO and other key partners, our Pandemic Prevention Institute is focused on connecting data to action. Together, we can see signals earlier and stop outbreaks before they become pandemics. Third, as we continue our efforts to end this pandemic and prevent the next one, we must also ensure those efforts also further the goal of building strong public health systems. At the Foundation, we share the WHO's goal of leveraging data and digital innovations to bolster community health systems and improve health outcomes. As you know, we have a lot of work to do together. Thankfully, we're building on 70 years of partnership. Over the next 70 years, I believe we can together harness the power of data and innovation so that everyone, everywhere can be healthy despite the 21st century's crises. I look forward to continuing to work with all of you, and I wish you all a very successful assembly. Thank you.
Well, thank you, Dr. Shah and Dr. Tedros. You know, before we dive into our panel discussion, we'd like to show one more video of the Rockefeller Foundation's aforementioned Pandemic Prevention Institute, a key example of the Foundation's collaborations in the global health space and how their catalytic investments in health build a healthier and safer world.
When it comes to outbreaks, there are usually signals of an emerging threat. A spike in sick workers just outside of Baton Rouge. A new flu variation in hospital patients in Melbourne. Some warning signs are obvious, but others, not so much. A traffic delay in New Delhi. An unusual presence of bacteria in the wastewater in Ukraine. Outbreak of varicella in Sao Paulo. Bird migration in Kuala Lumpur. Canceled flights out of Denver. Rising dairy prices in Hanoi. Strange insect behavior in Lisbon. A rush on bottled water in Cairo. Production line slowdowns in Busan. Every single one a source of data. By themselves, each point might not mean much. But when you connect the dots, a picture begins to form. To prevent the next pandemic, this is where we need to start. Linking different data types, interpreting those indicators with the latest technology, and sharing the earliest signals that something might be wrong. This is the mission of the Pandemic Prevention Institute, translating data into insights that inform decisions and save lives. The Pandemic Prevention Institute will support partners across the globe as they gather high-quality data from different sources: animal and human health, mobility, social, consumer, and more. And where information is scarce or analytic tools are needed, we'll work together to help fill gaps and unlock fresh perspectives. To create these connections, we'll use the most advanced tools. With machine learning and data science, we will produce solutions that reflect what's important to the decision makers, whether they head nations or households. That means engaging everyone, from school districts to state health agencies to international organizations. Support and cooperation at every level is essential to keep us all safe. If we want to avoid another devastating pandemic, we need to be able to see what's in front of us, understanding the signals, speeding the response. We can change how our world detects and responds to these early warnings. And if we do that, we'll be better equipped to stop outbreaks before they get out of control. We can do it. We must do it. Through sharing, collaboration, and trust, we can see the signal, speed the response, stop outbreaks. The Pandemic Prevention Institute will make it possible.
Now let's dive into our panel discussion focused on how we can collaborate to support one another in building a system for pandemic prevention and monitoring, as you heard, for future health threats. Please join me in welcoming our moderator, Dame Sally Davies, the UK Special Envoy on Anti-Microbial Resistance, and a longtime leader and advocate across many issues in global health.
Thank you very much. How do I turn this on? Is it on? So I'm going to start by asking all of you at the back to either listen and join in or go home. I think it is absolutely wonderful that the Rockefeller has set up such an interesting discussion, and I want you to be part of it, not as background noise, but as participants. So let me welcome up here as well my colleagues who are going to join in and talk with us. We are going to, in a minute, start with, but come and join me now, Dr. Chikwe. I can never say it. Come on, say it for me.
Ihekweazu.
Thank you. You see, it's much better when he does it. As you all know, he has, not that recently now, moved on to work in Berlin running the WHO Berlin Data Hub. So we're really interested how this new Assistant Director General of the WHO is going to make it work. And we want it to work and we want to help you. So the discussion needs to help that. Dr. Rick Bright's going to join us next up here. He's the CEO of this Pandemic Prevention Institute and Senior Vice President at the Rockefeller. Great to see that short film to give us a feel for it. And Dr. Ahmed Ogwell Ouma over here, the Deputy Director of the Africa Center for Disease Control and Prevention, who's fantastic. And finally, joining me up here is Dr. Judith Wong, the Director of the Microbiology and Molecular Epidemiology Division in the National Environment Agency of Singapore. So it's a great privilege for me to be here moderating, but actually for all of us to be here. Thank you to the Rockefeller. It's not an exaggeration to say that the last 2 years have been the most challenging and devastating for healthcare globally, and probably that we will see, have seen at least in our lives, and I hope that we will see. Out of necessity, we have seen collaborations across stakeholders and sectors on an unprecedented scale and pace, and I personally welcomed bringing in the private sector as they do make the therapeutics, the diagnostics, the vaccines. I hope that this is all going to become the rule rather than the exception, and we're celebrating partnerships tonight and looking at a path forward to a world better prepared for pandemics. After all, COVID-19 is not the last pandemic, and it hasn't yet finished. And indeed, I would argue, as many of you know, it's not the only pandemic on our planet at the moment. Anti-microbial resistance, known as AMR, emerges when infections become difficult to treat and sometimes impossible. When antibiotics, miracles of science, stop working. Without antibiotics being effective and equitably accessible, modern medicine, as we know it, will fall away. So, AMR imperils our ability to ensure everyone everywhere is safe from global health threats. It undermines UHC, the SDGs, and it blockades our ability to really make progress. And actually, you probably know that there's new data out in February in The Lancet showing AMR is now the third leading underlying cause of death globally. And we were interested to discover that it was even the Rockefeller Foundation's forward thinking back in the 30s that gave a grant to Alexander Fleming on his discovery of penicillin. They helped him develop it. I bet most of you didn't know that. So there's the Rockefeller at the center and forefront of innovation for almost a century. I'm delighted they're going on, doing it now and thinking out of the conventional boxes by one of the things they're doing is helping us from the UK take a musical on AMR and the life of Fleming to Washington, D.C. this autumn. And I hope you're all going to be there with us for that. It's great fun as a way of sharing information and building friendships and partnerships. Because we need partnerships between science and arts across the One Health spectrum, between communities, across borders, and that must become the hallmark of our post-COVID-19 world. We mustn't go back to the silos. So we've got this stellar group of experts to discuss learning from COVID-19 and how we can collaborate across sectors, prepare for the future and emerging health threats. And I hope they're not going to forget AMR. Well, of course, I won't let them, will I? Each of our panelists, as you've heard, work across the various aspects of pandemic prevention and preparation. They bring perspectives from all around the world, genomics, environment, data sharing. And that's important because no single grouping or entity can prepare for a future pandemic or emergent health threats alone. We need to harness what we've got and build even more. We need to do it together. And we're going to discuss what an effective pandemic prevention system looks like, how we can collaborate, so we end up in nirvana with a system truly comprehensive, equitable, and effective. So I'm going to do this by asking each panelist one question, and then, if time allows, a couple of follow-up questions at the end. And you've got your own microphones, so I'm going to start with Chikwe. And I apologize again for failing on your surname. I've been to Nigeria and they still couldn't educate me. This week, the World Health Assembly will consider how member states, WHO, and non-state actors can work together to strengthen pathogen surveillance, sharing of data, and financing in a timely and equitable fashion. What does this collaboration across sectors look like in practice? How can non-state actors support and work with this and the WHO?
Thank you, Dame Sally. Name is a little bit easier than mine, I guess.
Sally to my friends. You can drop the Dame.
Anyway, no, I think really it's a new day for the work that we do around health emergency preparedness and response. I've been somehow coincidentally worked in this space for the last 25 years, worked in national public health agencies, half of my career in Europe and half in Africa. I don't think there's been a time quite like this, where both the political attention, the funds, the consciousness of citizens has coalesced around the need to do the work that we have to do moving forward. And I don't think humanity will forgive us if we don't. So, firstly, the organization I'm now in is putting forward a pathway forward around this new framework that is really based on 3 broad areas. Financing. Firstly, obviously soliciting for increased access contributions to the organization itself so that we can do the work that we do and prioritize the work we need to do for countries outside of other influences as much as possible. Secondly, a new governance framework so we all know how to hold each other accountable in countries for the work that we do. But thirdly, and probably most important, is around the systems. How do we actually do this work? And, so we've been fairly reactive, agile in the last couple of years and initiated the Act A mechanism with other partners, new biohub, and also the part of the organization I now lead, which is actually the WHO Hub for Pandemic and Epidemic Intelligence. And unique to this is really from the very beginning, realizing that we can't do this on our own. So this is moving away from the kind of old framework where WHO does it for countries, right? Nigeria comes to WHO, how do I solve AMR? I give you a guideline, I send people, I buy equipment for you. To one that is really working with countries, with partners in order to deliver. So when people ask me, what is this hub? I said the critical thing is that we're not going to be a collector hub of data, rather we'll be a connector hub. So connecting nodes across the world to serve the people that we need to serve, and we'll be open to work with others and the expertise they bring to do that. And whether that's great organizations like Rockefeller that have unique skills, expertise, reach, whether that's academia, almost every university now has a new pandemic institute, like countries, philanthropy, wherever they're coming from, to answer specific questions. And the questions, sometimes they seem easy, but they're actually fairly difficult. In order to share, very often we're distracted in the conversations we have by countries that we feel don't, or actually are refusing to share for whatever reason. But my premise has always been that there are many countries that actually want to share and want to work together, but we've never offered them a platform to do so. And so the work Africa CDC is doing on the continent and has been doing since Ebola has really been unique, because even if it's just convening countries with the legitimacy they bring with member states, it's a great opportunity for us to grow and to connect. And so what WHO now is doing is really raising its game, making sure that we're there to enable that connection happen. Do the work we do very well around setting standards, making sure it's possible, doing governance. Just 3 weeks ago, we worked with the Rockefeller and some other colleagues to set up a new principles on sharing genomics data. People think, okay, it's very easy, you collect your data, but how do you share? How have you agreed what to share, on what basis, at what time intervals, under what guiding principles? So there's a lot of background work that we need to do in order to get this done, and we're very excited not to have the responsibility of doing all of this ourselves, but really to work in collaboration. And to do that needs, yes, the hard parts, the money, the wherewithal, but critically, and this is what will really require some time to build, saw it in the slide, is trust. It's how do we work in a world, in a context that is probably more divergent in many ways than ever before. And we build that trust across different levels, across geographical diversities, across professional diversities, across even within our context in different silos that we've all put ourselves. So that, Sally, what next you're thinking about the AMR challenge? We're not just thinking about it like AMR, because AMR, in my experience in Nigeria, there's nothing that brought us closer together with colleagues working in the agricultural sector, pharmaceutical sector, private sector, environment, and AMR, because there's nothing we could do on our own. So we had to actually bring all those colleagues together. And the AMR work was really, for us, in my previous role, the entry point into that One Health concept that we all talk about, but sometimes it's difficult to operationalize. So I'll pause here. I'll go into detail later opportunities maybe, but that's just to set the scene. Thanks.
Thank you. I'm going to push you on one thing, because clearly to set up the platform, and by the way, I love that phrase, connector, not collector. I'm going to borrow that one with pride. It's just a great one. But a lot of this is based on standards. So you've clearly had one discussion about genomic standards. How are you going to make sure that we have the standards so that we can collect it or connect it, put it on your platform?
We will create the standards with our colleagues. So the unique thing about this hub is we are designing for collaboration from the very beginning, with even the most mundane things, right? In the building we're setting up in Berlin at the moment, we have workspaces for 120 people. We don't plan to have more than 60 to 70 WHO staff working there at any point in time. The rest of the space will be open to colleagues that we will bring in. Might be academics, they're not interested in leaving their tenured position wherever, but they have an interest that would help the work we do and obviously feed into public health policy. Bring in a specific group of academics around the world that are working on that subject matter. Come and sit down with us. Do that thing that academics write at the bottom of every paper, that you hope your research will guide policy. And actually bring it to Berlin to sit down and define how it will get into policy. And our work with them be to say, listen, we've brought you together, and then we have then the legitimacy to take that to our member states and say, listen, this is what the experts have agreed on this issue. And now, given these experts, this is a good way to move forward. So we want to really be intentional in making sure that we bring in not only the relevant expertise, but the relevant expertise from around the world, even from those places you may not often have on the table when these discussions are held.
Fantastic. You make it sound doable and believable. But I think what we need is a series of fellowships so we can send you the best academics.
It's in the plan.
Oh, great. So I'm going to move on to Rick and ask you, because this is actually your expertise, what do you think is needed to be better prepared to detect outbreaks, and what role can the Rockefeller Foundation Pandemic Prevention Institute play to achieve this?
Wow, that's a loaded question, but thank you, Sally. It's such a pleasure to be here and on the stage with the colleagues that are having an impact, I believe, and not only in the current pandemic, but in shaping how we can do better and detect another outbreak before it becomes a pandemic. I think the key thing that we need is a system that will enable the collaboration of scientists. Scientists in the public sector, and in the private sector, in governments and member states, non-member state entities, academia, and connect all those data. It's a key word, as Chikwe said. This system isn't just about data, isn't just about technology. It is more about transparency and collaboration. It's more about timeliness and an always-on system that is there working every day to be able to detect something newly emerging or spreading or changing in some way, so we can know that something has changed and we can intensify a response mechanism much sooner than what we saw in this outbreak. All of that, transparency, collaboration, trust, timeliness, equitable access to the information, it can't be held in the hands of a few scientists, a few powerful countries, a few large entities. It must be accessible to everyone to be really impactful, to make a difference in how we communicate and share. And that is what leads to trust. I'm going to use this two words that Chikwe used, connecting and trust. And if we don't have that ability, we're never going to do better than what we're seeing now. The Rockefeller Foundation, I'm very grateful for them being supportive of a vision to establish a pandemic prevention institute that we'll focus on a few pillars to contribute to this ecosystem of an early warning system that we need to get in front of these outbreaks. And some of the key areas we're focusing on is collaboration. We must collaborate. We want to collaborate with the WHO as we have for 75 years, and we want to collaborate with the new hub that's being established, the WHO hub, but also national hubs, academic hubs that are generating data. And we also want to encourage collaboration. So one of the partnerships that we formed was a partnership with GISAID. And GISAID is a global community of scientists that have contributed to the data set that we all have relied on in this pandemic. We wouldn't have rapid vaccine development or diagnostics and drugs if we didn't have that global system of scientists who are trusting that system and sharing information. They're getting acknowledged for their work, and that has been something we've missed in the past, and they are collaborating in a new way. So that, I call it a GISAID community, is so important to sustain and strengthen, so we have something like that even beyond COVID. We're also supporting training. And so it's one thing to have data, and it's one thing to drop in sequencing instruments and reagents. But if you don't have a workforce, a local workforce who knows how to interpret those data in their local context and an ability to connect those data in a global context, then you just have a pile of data. And a lot of it sits on fax machines or on the desk somewhere. So we've been supporting, one example, a number of partners around the world, but one good example is the Stellenbosch University in Siri in South Africa, the Center for Epidemics and Pandemics and Innovation. And they have now trained over 100 scientists from over 45 countries across Africa. And those scientists are working together. They work together for the early discovery of the Omicron variant and new variants emerging across the continent of Africa. So working with entities like those and broadening those partnerships across the globe are really, really important. Enabling a local knowledge economy so they can identify local challenges and respond locally without having to wait for a global entity to tell them they have a problem, and here's what it is. A third thing is innovation, and there's only 4 things, I won't talk all night. A third thing is innovation, and one key area of innovation, example that we've been supporting, is bringing in other types of data. So we've been really all in on environmental data, wastewater data, which we're going to hear a lot about from our colleague. Wastewater data and air sampling data, bringing new data to the table, connected with our clinical data. Because if we wait for a blood draw or a nose swab in a clinic, it's too late to really get in front of an outbreak. But we know wastewater data and other environmental data, and bringing together other data types, consumerism, mobility, environmental, climate, can tell us a lot. But the last thing, our 4th pillar to focus on, is an ability to connect all those different data types. Not just connecting scientists connecting genomics data, but also focusing on building this, what we call a stack architecture. And it's a global platform system that will allow us to connect all these different disparate types of data and bring modern analytics to those data sets to strengthen our insights, to learn that something new is happening. And we can apply that technology and that modern analytics, not just to COVID, not just to find a new variant of SARS-CoV-2, but to the AMR world. Think of the value of bringing together additional data types around the world into the AMR genomic space, that there's a lot of data actually. But also, I think by connecting these data types, enhancing our insights, making sure they're accessible in an equitable way to everyone around the world, and then driving the translation of that into action. Because again, all this data, no matter how fancy or pretty it is on a chart, is useless if it doesn't drive action. And the action we need is at the political level, the national, the local, the state level, but also at the individual level. People need to be empowered with knowledge of what they can do to help stop the spread. And those are key areas that we're focusing on at the Pandemic Prevention Institute. Thank you for asking.
That'll keep you out of trouble, I reckon, for quite a while. And as you know, I absolutely think you're getting it right. We ran from Trinity College in Cambridge, where I'm now the master, a challenge, just that, as you know, about data and using it differently. And the 8 winners are doing work that you're going to want to use because it is just phenomenal. So we'll make sure you're all connected. Great. So moving on, Ahmed. The African CDC, as you know, I think you've risen to the leadership challenge during COVID, and I'm thrilled that you have. But you've been working to build genomic screening and sequencing on the continent. What's that taught you, these efforts about scaling up, and what else is needed to help the African countries monitor and prepare for pandemics? I have to say that I spend a lot of time in England saying just because they picked it up in South Africa or Africa doesn't mean it happened there and it's their fault. It just means they're getting really good at science and they're being great and telling us about it. So I do want to say thank you for all the work that's going on.
Thanks, Sally, and it's good to be with this very eminent panel. Now I feel a lot better than I was before I came in. You know, the shine always gets, you get to enjoy the shine of the others. And good evening, colleagues. I think the saying that don't waste an outbreak, don't waste an emergency, don't waste a pandemic, it rings extremely true for the work that we are doing on the continent in pathogen genomics. Of all the things we've done, this is where we've, I think, really not wasted this pandemic. And it didn't start with the pandemic. Back in 2017, we started mapping what's there on the continent. What do we have in terms of institutions, infrastructure, and technical capacity. And when we got that data, we sort of were thinking, now what do we do with it? And then, of course, COVID came and we knew exactly what to do with it. Looking at how we've responded to the utilization of this new tool, we broke it down into 3. First, because we had the data mapping what is where, we could be able to tell which institutions needed how much effort to truly get into next generation sequencing. With that knowledge, we went into the second bit, and that was how do we build partnerships that will be able to support those national level institutions. And then third, we grouped the institutions into the different levels of expertise and capacity for sequencing. So we have 3 levels now. The highest level are the centers of excellence. And today I will not mention them by name so that I don't forget one, and then when I get out of the door, someone will accost me and tell me you forgot ours. But we have centers of excellence, and we deliberately are calling them centers of excellence because the kind of work that they're doing is, frankly, allow me to say damn solid here because it's serious. It's frankly better than what's happening elsewhere in the world. And we've picked up on variants and sublineages that others have not done. And yes, indeed, we are very generous at sharing the information. We suffer for it, but we'll continue to share. Then the next level are the regional labs and institutions that will be they backstop the national labs. So if a national lab has too much to do, then it will be sent up to the regional lab, and the centers of excellence is where we sort out issues that don't look too clear. And then we take it to the real experts, and they tell us what kind of pathogen type or subtype we are dealing with. And the regional labs have played a very big role in ramping up the sequencing that we're doing on the continent, because countries that don't have any capacity at all have utilized the regional labs to be able to get there samples to be sequenced. Now, at the national level, what we are doing is every institution that has the potential to do next generation sequencing, we are supporting them to do that. And we support them in, one, building the capacity of the laboratory scientists, indeed even management of those institutions. Second is we are modernizing the equipment that they use so that we can be able to get a quick turnaround time on sequencing. And third is we are providing reagents. You know, a lot has been said around how difficult in the peak of the pandemic it was to get PPEs, and now how difficult it was last year to get vaccines. It was a horrible experience trying to get reagents for sequencing. And this is something that we will document one of these days and name names as well. Because countries blocked exports of reagents. And here we were on the continent trying to get as many samples as possible to be sequenced so that we have a good idea of what we're dealing with on the continent. So it's a lesson well learned, and as we go into this, I don't want to call it post-pandemic because it's still very alive in Africa with 16% vaccination rates, although those who get the virus and a decent amount of immunity are there as well. But when you look at vaccination rates only, it is quite low, and we want to ensure that we can be able to raise that as close to 70 as possible. So going into the period after the peak of the crisis, we are expanding the pathogen genomics area of work beyond just sequencing. And as Rick was saying, if you don't have people who can interpret the data, then it's just a pile of data. And bioinformatics now is forming a very core part of what we are doing with both the national, the regional, and the centers of excellence to ensure that we have enough people who can be able to interpret the data. Even those countries that don't have any capacity at all to do next generation sequencing, we are training in bioinformatics so their data that has been sequenced elsewhere, they can be able to interpret it for policymakers and plan ahead of time. Finally, on this is to say that the Africa CDC's Pathogen Genomics Institute, and by the way, we formed the institute before the pandemic, is now fanning out into all pathogens. In fact, member states now, every time there is any outbreak, the first question will be, can you sequence it? We know what we are dealing with. And that leads us to the next value addition, so to speak. We want to start to utilize that data to get good prototypes of diagnostics. We want to utilize that data to encourage deeper research into therapeutics and vaccines. And we want to utilize that data to show just how much can be able to be done with a little, so long as there is focus, there is vision, and then there is passion and commitment to be able to deliver. This is our plan, and with all your support, and Rockefeller Foundation has been very good at this, we are sure that we'll be able to reach there and the world will be the better when we succeed in that. Thank you.
It will be better, and your passion and commitment is wonderful. Thank you. So moving on to Judith. What role does environmental sampling play in a pandemic prevention system? And what innovations have you seen coming out of this pandemic? Can we scale best practice to all settings? And how does it play out between high resource and low resource? Can we share environmental data and sampling methods?
Right. Thank you, Dame Sally. And also thank you to the organizers for remembering the environment in the pandemic prevention. So in terms of the environment provides hidden clues on disease transmission. And I think the COVID-19 pandemic has seen how wastewater surveillance has taken off. In terms of environmental surveillance, the surveillance itself is non-intrusive and it's independent of the health-seeking behavior of individuals. So this actually allows us to do testing and surveillance in a passive way. And because it's non-intrusive, it can also see through different ways and different phases of COVID. As for example, as testing strategies change, whether the clinical testing is stepped up or stepped down, the environmental surveillance can be a form of baseline, which is very useful. Now, for wastewater surveillance, we have seen that wastewater surveillance can actually provide early warning, as seen in the Netherlands and also in Paris, where signals were detected before cases or the waves were detected. Additionally, in some use cases, for example, in Singapore, we have used wastewater surveillance during a period where COVID-19 control was necessary, when vaccinations were still not up. And we had to do case investigations, case detection, as well as early treatment and quarantine. So when that was happening, testing resources were in a way strained. So wastewater surveillance was complementary because we could test neighborhoods and zone in and divert testing resources in neighborhoods of concern. So this allowed the testing resources to be used efficiently, and it then complements clinical testing. Right now, as most countries are learning to live with COVID, wastewater surveillance or environmental surveillance also allows us to understand the trajectory of infections. And it also allows us to also detect cryptic variants and things like that when they do pop up. And it becomes more important now, especially when clinical testing has stepped down to some extent. In terms of environmental surveillance, apart from wastewater surveillance, there's also air and formite surveillance. Unlike the use case for wastewater surveillance, where we are really understanding the prevalence of infections, these two other modes of surveillance are supportive. They help us to understand the mode of disease spread. For COVID-19, we have seen how the likelihood of it being airborne became more obvious as the pandemic progressed and as variants emerged. And the environmental surveillance efforts helped us to, in a way, guide the mitigation strategies and target which are more effective or which are more relevant, depending on the settings and use case. So to your next question about innovations that has emerged, so we have seen that the multidisciplinary efforts has really come together with the pandemic. Not just the environmental aspect of like surveillance, where we've really come together to work with, for example, the health ministries and things like that. But in terms of innovation, we also have like engineers trying to develop innovative mitigation solutions. So instead of doing wipe down, which is very laborious, we also innovate to do it more effectively. And there are also building and engineers that look into ventilation systems to help to improve and mitigate some of disease transmission risks. So, well, these are innovations that we see, but if we were to consider about what could be scaled in terms of low-resourced or better-resourced countries, I would think that the better-resourced countries, it would be really great if evaluations, if innovative developments are, they focus on these, so that when the evaluations are already done, we can identify the most cost-effective ones to be implemented to maybe the lower-resourced ones. So one example that we have seen in wastewater surveillance was that of the surveillance or test method. So there are very costly ones, and then there are the more practical ones, which may be a bit more time-consuming. But then because the scientists were able to evaluate all the different methods, we would then be able to identify the best ones for each use case.
Thank you very much. So we're now almost out of time. So the push I was going to give you all on where does AMR fit, we'll have to wait for the next meeting. So please, Rockefeller, can you set one up on AMR? But I would argue that where politicians often are is, so we have to do this when we've got a pandemic and we need something running along just to pick them up and try and prevent them. What should be running along is surveillance for AMR as well as new things, and that's how we keep the systems alive and working. So I hope we can make that happen. You've said a lot. There have been some strands running through. The strand of the difference between information and data then being turned into knowledge. The strand about connection rather than collection, about learning together but needing to train people and find innovative ways to do it. And I think the belief that we need to bring everyone in to make this work. But above all, you also spoke about trust. That does matter, particularly when we're talking about data, whether it's of bugs or people. And I think we in this room can all share that we trust the four of you to take this forward effectively, and please go on making a difference. Thank you very much.
Thank you, Dame Sally, and because a dame said it, of course, the next meeting we'll arrange will be about AMR solely so. But again, I want to thank Dame Sally, and of course to our excellent panelists. Now, it's clear that much more needs to be done to recover from the COVID-19 pandemic, and that we need to take these hard-earned lessons that we've heard here and impressive innovations that we've heard as well forward as we build a global health infrastructure capable of detecting and tracking emerging health threats. I want to take the opportunity to again share the Rockefeller Foundation's pleasure to be admitted into the official relations with the WHO, and we hope tonight can honor the spirit of collaboration by uncovering new ways we can work together for a shared vision of a healthier and, again, more equitable world. So this, as was alluded to earlier, brings us to the end of our spoken program. And I invite you to continue the conversation and the collaboration that the world needs to make a difference. So thank you so much.